Hello and welcome again. Thank you for joining. Previously, we already started with Newcastle disease. The Newcastle disease, which is one of the deadliest diseases in poultry. Now, it's all one of the series of diseases that is prevalent with avians, that is fowl. Let's drive it home, chicken. Now, we talked about infectious bronchitis, we talked about the Gumboro disease. We've also talked about, in previous times, we talked about the Mareks. Now we're looking at one that is considered perhaps the deadliest, the Newcastle disease. We started in the previous class. So you want to see what are the things we've done, you want to see some of what we discussed in the previous class, you want to check the previous video. And by the way, thank you for liking and sharing. If you've not, please share. Like, subscribe, and also follow, so you get more of insightful knowledge that will help in empowering you. Of course, they say knowledge is power, and give you balance, stability in terms of doing your work if you're a poultry farmer. Now, we already started in the previous class. This is Newcastle disease. We did the historical perspective that it's named after a city in the UK, that is England precisely, and that's about 1927, but it has been in existence before then, about 1886. So it was actually said to be discovered first in Java, Indonesia. Now we also looked at other names of it, being pneumoencephalitis. That is something pneumo, I said in the previous class, had to do with the lungs and breathing, and encephalitis had to do with encephalitis, pneumoencephalitis. Thank you. Having to do with the brain and the inflammation of it, the inflammation of the cells, of the inflammation of the lungs, and also the brain. Now, I talked about something making it easy to understand things in science. Just try to break it into different parts. Like pneumo will give you something that has to do with the lungs, encephalo has to do something that has to do with the brain, and litis has to do with inflammation. So you read it from the back, meaning inflammation of the brain and lungs. These are the presentation. However, also included is the gastrointestinal tract. Now that's just going back briefly to what we did last week. We looked at the causal agents to be the Newcastle disease virus. The strain that causes this particularly is the avian paramyxoviridae type 1. Avian paramyxoviridae type 1. It is of the family Paramyxidae family. Now we also classified it based on the severity to be velogenic, Newcastle disease, mesogenic, Newcastle disease, and lentogenic, Newcastle disease. Now when you see velo, talking about severity, very severe, that is very severe. We talk about meso, talk about the middle, not as severe as this, and then we'll talk about lento, mild. Now today we'll be looking at how deadly this is. We're not going to spend time on, just briefly talk about what's come about this. In today's class, which is new, you want to get more, let's go to the previous class. Deadly it is. It is highly contagious. That's one thing about very deadly diseases. Now when we talked about Mareks, not as contagious as this, but then once it gets the animal, it's not as easily treated. In fact, most viral diseases, you may not easily treat them, you can manage them. Now, some people may be able to treat depending, and if you're lucky, the animal may bounce back properly, but more often than not, the animal will not come back the same. Now, highly contagious, spreads. Within a very short time, it goes. And another very important thing is, it has the capacity to wipe out an entire flock. 100% can go. If you're lucky, less than 100%. That means you have, let's say, some people you have 100 birds they can all go. 1,000, they can go. 10,000, they can go. The entire thing can go. It can be lower than that, of course, if you're lucky. Now, affects fowls of different age. That's another thing about it. It's not as if, like, for some, okay, it varies between this age and this age, and then once you've grown past it, it can be affected. No, birds of different ages can be affected. That's another reason why Newcastle disease is actually dangerous. Apart from the fact that I talked about, it can wipe out an entire farm within a short time. Within a short time, it can do that. Now, another thing about the Newcastle disease that makes it very, very deadly is the fact that it is zoonotic. I'll talk about zoonotism, or the fact that the disease is zoonotic, is because, or is based on the fact that it can be transmitted from an animal to human. Sometimes it may be the same presentation with the same signs, at other time it may be different, like in the case of Newcastle disease. This one doesn't affect and brings humans down with the same signs and symptoms as we're going to be seeing now, twisting of the neck and other things, or affecting the spinal cord. But it affects, guess what? A part in the eye, a particular film, a thin layer in the eye, in the eyeball, which is called a conjunctiva. And that conjunctiva is affected, it inflames it. Inflammation means making it to swell with signs of being hot and red and itchy. What we call in our local parlance here, for those, apologies to those outside this climb, we call it in our local climb here Apollo. I think it has allusion to Apollo 11 of the United States, 1969, the successful going to the moon. That was where people here say, oh, that was when this thing started. But the actual ailment, sickness or trouble of the eyes is actually conjunctivitis. Conjunctivitis. You see the reddening of the eyes. People call it Apollo, but it's actually conjunctivitis. Reddening of the eyes, and it becomes hot, sometimes swollen in the eyes. It comes usually during the very dry season, harmattan. But Newcastle disease can cause it if it becomes zoonotic. Zoonotic transferred from the bird to human. Any disease that goes from animal to human, zoonotic. So conjunctivitis, inflaming the conjunctiva of the eyes. Now, what are the signs and symptoms in any bird that have been infected by Newcastle disease? One of the things you see, very, very important sign, is a twisting of the leg, because it affects the central nervous system. That is where the encephalitis comes in. The nervous system linking the brain and the spinal cord is affected. So it forces the bird to twist its neck, and it's not funny. The bird turns its head like the head is upside down this way, and it's not a good presentation. Of course, it won't be able to walk well. It will just be running, going around and falling. The birds, these are things you see. You also see watery discharge from the nose of the affected bird, and if it's in cheek, you hear chapping sound. Chip, 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 chip. The sound is not very good to the ear. And you also see tremor, trembling. You see some kind of tremor in Gumboro disease, kind of tremor, trembling, because it affects the central nervous system, and it affects, it's not able to hold on. And also you see belabored breathing. Belabored breathing, that is where this comes in. Pneumo, it affects the lung, swelling of the lungs. So belabored breathing, difficulty breathing, belabored breathing. There's also swelling of the face, and there's also green coloration. Now, in this local climate, farmers who are not very well read or in this aspect to understand it, the first thing you want to know when dealing with farmers is what's the color of the pool, or what's the color of the dropping. Once it's greenish, now that's not for Newcastle alone. Some other diseases can also have presentation of green, but very green one presentation, you have this. And then there's paralysis. Now the thing is this, by the time you'll be drawing conclusion that it's Newcastle disease, you should have 2 or 3 or 4 of this presentation, not even 5 of them. Say, okay, how is the animal behaving? What do you see? Twisting of the neck. Oh, cheek is chipping, and then chipping sound, and then you also see the paralysis, you see belabored breathing, you see discharge from the nose, and then the veterinary doctor can say, oh well, this should be Newcastle disease, especially if the dropping is greenish. Now that's not to say we've overflogged this reduction in feeding. Of course, a bird that has twisted neck, the neck is upside down, the head is upside down, won't eat well. And following loss of appetite always is loss of weight. You don't eat, they don't eat, they don't add weight. And if it's a bird that is laying, they won't lay. That's another sign. These are the 3 signs. They won't lay. For now, we'll draw the curtain because of time and the length of the video. I want you to stay tuned. In the next class, we'll be looking at treatment, possible treatment, is it possible? And then we'll be looking at prevention of Newcastle disease. I want you to come and to join the class. I mean, watch the next video. We'll be giving this and even more on it. I want to thank you for staying tuned. Thank you so much. Let's draw the curtain now. Bye-bye.